Hello, my name is Dr. Mareya, and today I just want to speak to you about how to differentiate between the symptoms of COVID-19, the common cold, and what we call the flu. Now, basically what happens is COVID-19 tends to come on gradually. There's a gradual onset, starting off with mild symptoms which then worsen up to quite severe symptoms over time. The common cold tends to also have a gradual onset where it also remains mild in terms of its symptomatology, but then you find that you don't get much worse over time. Then the flu tends to have a very abrupt start to the symptoms. You find yourself one day you're okay, the next day you are very, very sick. Now, starting with one of the major symptoms, which is fever. COVID-19 causes a fever upwards of 38 degrees, as well as shortness of breath and difficulty in breathing. These are very common with the COVID-19. And then a very dry, persistent cough. This is common with COVID-19. Of note is you find that with the common cold, you may not have a fever, but it may occur sometimes. And with the flu, you will not have a fever unless you have a superadded or added bacterial infection. With the shortness of breath in the common cold and in the influenza, you will not have these symptoms. With the cough, you will have a persistent dry cough at times with influenza, and with the common cold, you may have a cough on and off. Now, there are other symptoms that are associated with COVID-19, which are fatigue, which happens rarely, but is very common with influenza. You have aches and body pains, which is not very common in COVID-19, but is common with the flu and the common cold. You also have the stuffy runny nose. This does not occur commonly with COVID-19, but with the common cold and with influenza, you will find that you'll have those symptoms. And lastly, you have the headache, which is not very common with COVID-19, but is quite common with the influenza. Trying to differentiate between these three can also assist in how you make your decisions of how you will seek medical attention.